there are some either comical or really sad scenarios that play out in Alzheimer's families. One in particular I'm thinking of is where a patient will keep asking the same question, or they'll keep doing the same behavior, and it gets frustrating to the family, and they'll keep correcting, and it never changes. So what's your recommendation to families in terms of correcting patients or dealing with that kind of repetitive motion, questioning, answering problem?
Yeah, I think that is one of the most common problems that caregivers have, because they'll get asked the same question 10 times a day, and then they, being human beings, snap, and then they feel very guilty for having yelled at the patient. And so I always tell them, well, congratulations, you're not a saint, because how boring would that be? And B, that they do really care about the person. So I say, don't make any corrections unless it's going to be something life-threatening. If the person keeps saying, you know, I want to, it's daytime and it's really nighttime, don't worry about it, unless they say they want to go out, get dressed and walk out and it's the middle of the night. At that point, you may want to intervene. So for the most part, be a duck, let it slide off your back. And if you are less than perfect, congratulations.
When you talk in your book about being emotionally correct versus factually correct, like again, like if they say it's the night and it's really the day, who cares?
Yes.
Like let them.
Right, because the patient feels a certain way, and then that's the way they feel. That is their truth. And then if you want to correct it with a fact, then one of two things could happen. Either they agree with your fact and feel really stupid and sad about that, or they don't agree with your fact and get angry with you. So neither of those are outcomes that you want. So why engage in that? Because they're feeling a certain way. Unless it's going to be causing some kind of harm, let it be. One fear that caregivers have is they worry that if they don't correct, then that means the dementia will progress more or the Alzheimer's will progress more. And that's absolutely not true. You can let something not be corrected and the person's dementia is not going to progress based on that.
So, and then underneath that is helping the patient maintain their dignity in it. Again, having the fight, pushing back on them, is just going to create emotional angst versus go with their fantasy or go with whatever it is.
Yeah, I think that the point of this is to allow the person as much independence and confidence. And one of the things that I try to tell families is if the person's confident, it's really good. It's good for their mental well-being. It's good for their outlook. It's good for their sense of anxiety. So you want to promote confidence. And if that means if you're quiet about certain things that aren't necessarily true, but it allows the patient to feel good, then let it be. Yeah.
Great advice. Dignity always.
Yeah, thank you.
If you like what you just saw, come to our website. We have many more videos with Dr. Devi. You can buy her book too, The Spectrum of Hope. Here's mine. It's all dog-eared because there's so much important information in it about the new learning and understanding about Alzheimer's. And do me a favor, do that social thing. Let other people know about these very important videos. Come to our website, bottomlineinc.com.